video is going to look at the use of drugs. This is our first dot point that comes under the critical question of what ethical issues are related to improving performance. Now, I must say right at the outset, it is very key for you to remember that this use of drugs always is going to be asked in relation to ethical issues. It's not going to focus very much on whether or not they actually cause benefits, how they might be used. It's about whether they're ethical, whether it's ethical to use them. Okay, so you'll learn about is quite long here. So use of drugs, you have to know the dangers of performance enhancing drugs, such as the physical effects, loss of reputation, sponsorship and income. You need to know use of drugs for strength gains, so human growth hormones, anabolic steroids. You need to know EPO for aerobic performance. You need to know about diuretics and alcohols when it comes to masking other drugs, and then the benefits and limitations of drug testing. Now there's two learn tos for this learn about for this dot point, and it asks you to justify the reasons the drugs are considered to be unethical and carry a range of risks for the athlete. Notice there it doesn't say debate anything about it. It says that you have to justify that they are unethical. Okay, so don't ever say that they are. The second dot point that for the learn to is for you to argue issues related to drug testing, such as at what level of competition should drug testing be introduced, which drugs should be tested for, what are the pros and cons of drug testing, and what should be the consequences of drug use. So let's get into it. Drugs. Performance enhancing drugs are substances that can improve an athlete's performance in a particular sport or activity. Drug use in sport or doping carries serious health risks and can jeopardize an athlete's future in that sport, or really in any sport in the future. There's lots and lots of dangers that are associated with the use of drugs. So that includes physical health risks, but they are all drug specific, and we'll look at them as we look at each of our drugs. There's going to be a damage to their reputation. You think of any athlete that's been caught using drugs, they're going to no longer be the person who is, the face of that sport. They're no longer going to be used for sponsorship. Their sponsors are going to start to pull out because you can't have a disgraced athlete representing your brand. So they're going to lose income due to loss of sponsorship. They also might get kicked out of their team. They might get fined. That's further loss of income. And it's going to be completely career altering, if not career destroying. So for example, Lance Armstrong was expelled or excluded from cycling completely. He's not even allowed to go and ride at his local club. Use of drugs for strength. Let's have a look. Human growth hormone. Now this is a natural hormone that occurs in your body, but we use chemicals and stuff to create a very similar thing that people then inject into their body. It is used to increase muscle size and strength. It also helps to mobilize fat a bit, but most of this is going to be used for developing our strength. Human growth hormone has some really detrimental long-term effects. So it can cause a thing called gigantism, which is when your just masculine features are really large and prominent. It's going to cause swelling. It's going to cause muscular weakness because they're going to grow, but they're going to grow quick and undeveloped. Can cause diabetes, heart disease, bony overgrowths, so like a really large chin, large nose, large forehead, those types of things. And it can also cause osteoporosis. So there's some of our health risks, our physical risks that are associated with human growth hormone. Anabolic steroids. Anabolic steroids are a derivative of testosterone. Now testosterone is the hormone that increases largely in males as they go through puberty and stuff, and it's what gives males all their secondary sex characteristics, largely used for increases in strength and increases in power. Now, increases in strength and muscle size are always associated with anabolic steroids, but you have to use anabolic steroids with training in order to get any improved performance or any increases in muscle size or strength. If you use it just by itself, it actually does absolutely nothing. All right. Some of the side effects of steroid use. So there is things like being aggressive, being irritable, getting acne, baldness, hypertension, which is high blood pressure. You can get a whole bunch of heart issues, liver damage. All your male secondary sex characteristics are going to develop. So that doesn't matter whether you're male or female. You're going to start to develop your male secondary sex characteristics. You're going to get, if you're a female, an irregular period. Your clitoris will enlarge as well. You can get infertility occurring in both males and females. You can have diabetes start to occur, and you can develop high cholesterol issues. So lots of issues that are associated with the use of steroids. Using drugs now for aerobic endurance. So the main drug that we're going to look at here is erythropoietin. Now this is a natural hormone that stimulates red blood cell production and therefore more oxygen carrying capacity in the athlete. Erythropoietin is essentially a form of blood doping. And so blood doping used to also be done by taking blood out of your system, storing it, doing all your training, and then before performance injecting all that blood back into you to get all those extra red blood cells. Erythropoietin is going to give you those blood cells without having to do that. There are some other synthetic oxygen carriers that mimic hemoglobin that athletes use as well, but they all essentially going to do and have the same kind of risk factors as erythropoietin anyway. So the risks of EPO or erythropoietin, it's going to thicken your blood, okay, and the thickening of your blood is going to cause a whole bunch of other issues. So thickened blood is going to cause hypertension, so that high blood pressure, which is going to cause things like heart disease. It's going to cause strokes. It's going to cause cerebral or pulmonary embolisms. And so you're going to have a whole bunch of problems, mostly that are results from having really thick and viscous blood. Okay, the same thing for your synthetic carriers and for blood doping, where you're transferring that blood out and then back in, same kind of risk factors. Shifting now to using drugs to mask other drugs, the main ones that are used are diuretics. So diuretics are used to dilute the urine. It reduces the fluid in your body and it decreases the concentration of the excreted drug. So if you're taking steroids or human growth hormone or something and you've been told you have to take a test, you might take a whole bunch of diuretics, which then means that when you wee into your cup and they go and test it, your drug that you've been taking is really watered down and so it may not get picked up. However, your diuretic will get picked up and then you get banned for using a diuretic because they're going to presume that if you're using that diuretic, you are also using drugs. Okay, so diuretics are used to improve appearance sometimes, can be used to decrease weight. If you need to make a weight for like boxing or something, they might use some diuretics. But the main thing that they're used for is those masking of other drugs that athletes have been using. Lots of side effects of diuretics: dehydration, dizziness, headaches, poor concentration, heart and kidney disease, fatigue, chest pain, depression, irritability, electrolyte imbalances, and impaired hearing. So lots of side effects just from diuretics. Mostly they're all results of being heavily dehydrated. Alcohol is another type of diuretic. It also works as a depressant, so it's going to slow down your nervous system. It's normally used to mask other drugs, and because people, it's a normal thing for people to drink alcohol, and so they think that they might kind of get away with it, but in a lot of sports it's banned. Side effects of alcohol, well, they're essentially side effects of going out and drinking too much over the weekend. Nausea, vomiting, slow down your central nervous system, which means that you're going to have delayed reaction times, a lack of coordination, you're going to be dizzy, you're going to have blurred visions, you might become unconscious if you drink too much, and if you drink way too much, you could even kill yourself. So alcohol, lots of side effects. Then moving on to the use of drug testing. So drug testing, there are benefits and there are limitations to drug testing. So let's start with the purpose though. The purpose of drug testing is not to catch cheats. Okay, drug testing is used to promote fair play, to promote safety in sport. Even the WADA, the World Anti-Doping Agency, their tagline is to play true. It's all about promoting a drug-free sport. Athletes generally are quite happy to be tested and are quite happy that testing exists, because if they do their test and they pass and they're clean, then they can sit there and they've got a good reputation. I've worked hard, I've deserved what I've gotten. Whereas if they fail it, it gets rid of those athletes that cheat, or at least it deters athletes from cheating. The benefits of drug testing is that it's going to deter our cheaters. It's going to promote drug-free sport. It's going to promote fair play. Okay, it's going to help to make sure that the playing field is more close to being equal. So it's about equity based on having no drugs involved. It's going to promote safety because all the side effects that are associated with those drugs are now going to be avoided. It's going to provide equity, which I mentioned. It's going to reward athletes for an ability and training and effort rather than the fact that they knew which drugs to take and how to cover that up. And it's also going to protect reputations. So they're your benefits. Limitations of drug testing are that basically there's a new drug list every year that comes out for your sport that the athlete has to have a good understanding of and make sure that they avoid using. Not all drugs actually get tested for. And that's because there's always new drugs coming out, and until they come out, they can't and get identified, then they can't get tested. Athletes are often exposed during their testing, so they're not allowed to just, pull their pants down a little bit. They actually have to pretty much strip naked and go to the toilet. That's essentially because there have been athletes in the past who have cheated and hidden other people's urine in their shirts, their jackets, in their pants, etc. And so now we make it completely exposed. And of course, it's also very expensive to do all those tests, to send all those urine samples or blood samples off to laboratories to be examined and analysed. So now one of the questions that you need to get asked to think about is, at what level should drug testing be introduced? So at this point in the drug testing existence, drug testing is really only done at the elite level, once athletes are really getting paid a lot and the emphasis is highly on winning. Okay, but should we be looking at introducing drug testing at lower levels, or maybe we should get rid of it altogether? That's a question that you need to consider as you think about the use of drugs in sport and whether it's ethical or not. One of the things that I'm going to add to that too is that as you work your way down, so you've got your elite athletes that are generally all tested, but when you work your way down into your local clubs and all those types of things, it's actually the clubs that are responsible for making sure that there is fair play and making sure they're looking after the athlete's health. And so it's actually the club's responsibility then to try and make sure and to support and help and make sure that our athletes, and even at the lower levels, are not using drugs and are maintaining fair play and keeping the sport clean. One of the things too at that lower level is that they're not as motivated to win, and so they're not as motivated to take those drugs for the purpose of increasing their performance. The next question is, which drugs should be tested? So should we be testing all drugs, or should we just be testing ones that are specific for that sport? What should we be looking at? So WADA, the World Anti-Doping Association, or ASADA, they do not test for the non-performance enhancing drugs. Okay, so they look at the sport, they look at what drugs will actually cause an improvement in performance in that sport, and they then become the set of drugs that they test for in that sport. Okay, so the focus there is all about performance and making sure that the athletes aren't cheating and promoting fair play. Now, they'll also say that that's helping to promote athletes' safety, but I actually would argue with them that there probably are a whole bunch of extra drugs that they should be considering testing for if it's about athlete safety. Even the use of painkillers and whether or not that should be used at various times in sports is about athlete safety, because if you're masking pain, you go out and play, you're going to increase your risk of being injured. And there's other drugs that are going to, if you're using alcohol and it's not banned in your sport, it's still going to make you at more risk of an injury as you play that sport. And a lot of recreational drugs also make it more dangerous for athletes as they play. So really, most of the recreational drugs tend to be out in the elite level, so that's probably why they don't bother testing for that. But should we be looking at that maybe then at the lower level athletes? And then you have to consider what consequences should be dished out for people who use drugs in order to cheat or make play unfair in order to gain that extra advantage in performance. So at the moment, each case is considered individually. It kind of it follows the rules and regulations that govern the sports. It's dealt with kind of like a judicial system where you would go to court. You have people who present cases for and against, and then the people in charge then dish out the punishment according to whatever that case particularly is. And normally those punishments are things like the athlete being suspended from the sport, maybe a fine being applied to that athlete, or if it's big enough, the athlete might be expelled or excluded from that sport. And then all of the awards that the athlete has are going to be stripped off them, all their titles are gone. Sometimes that's just the ones that are within the time period where they were tested and were found cheating. Other times they just take all of them off them because you've cheated, and we're going to presume that you've cheated the whole time.